Many have dreams to be a medical professional. When choosing an institution for medical school, a lot of things matter. The quality of the academic and clinical programs, as well as the clinical experience. At Unimas, we offer that and more. A supportive culture, a vibrant community, diverse student and patient population, all set against the backdrop of Kuching and Kota Samarhan.
The culture here is welcoming. It is a big family. Everyone wants the next person to succeed together. We want our students to reflect back to the society and the community today. As a community-driven university, we believe that immersing themselves and ourselves in the diversity, it creates better innovation and greater creative achievement.
In Unimas, there's not a culture of a competition here, but a great environment is what we all strive for.
Everyone is committed to create a great environment to become a great doctor in the future.
Our patient population in Malaysia is remarkably diverse. Different languages and dialects will be something that we face every day once we become a doctor. So, getting to know this and learn it now make us to be more appreciate and respect. It just set us up to become a better doctor for the future.
From the beginning of the program, 25 years ago, we have adopted a spiral curriculum. As the students advance forward into their years of clinical study, we connect everything back to underlying basic biological sciences. We connect and revisit every aspect of human health, from emotions to diseases, back to its basic biological sciences.
We are introduced to clinical setting early in our curriculum. The exposure gets more as we advance through the year. It was very daunting at first, as a first-year student, to step into hospital and seeing patients. But at the same time, it's really an exciting experience.
We are committed to excel in nursing education, research, and practice. It views health as a complex and dynamic, and the client as a holistic individual. Students in this program learn in an environment that stimulates intellectual inquiry and creativity, which encourages them to be problem solvers and lifelong learners.
Here, we learn how to care, to serve, and to help. We went from zero to hero.
I really cannot pick a better place to learn and become a greatness. This is a place that belongs to my heart throughout my journey.
Come do research with us.
Come and join us at Unimas and realize your dreams.
Good morning. Thank you all for finding time and joining us in our today's webinar. So my name is Dr. Sabrina and I will be the moderator for our third Health Talk series today, organized by the Faculty of Medicine and Health Sciences, UNIMAS. So the title of our talk today is Mars and Venus, Get Yourself Checked. We won't be talking about planets today. Instead, we will explore more on one of the components of preventive health care, which is health screening. We are streaming live via Facebook and YouTube, and I can see from Facebook so far we have about 178 viewers. Welcome. All right. So for our viewers out there, our secretariat will share a Google form link in the comment section for attendance registration. So please ensure that you fill in the required info correctly, as the e-certificate will be sent to the registered email within 1 to 2 weeks' time. Please feel free as well to drop questions in the comment section in Facebook and YouTube. We will try to address the questions as we go along our talk this morning. And together with me today, who will be sharing more info on this are my colleagues, Dr. Uy Chor Yao and Dr. Rafida Elias. We are from the Family Medicine Department of Faculty of Science Health, UNIMAS. All right. So Dr. Uy graduated with a medical degree from UNIMAS. He later furthered his specialization in family medicine in UM, and his special interest is in preventive care and men's health. Yeah. And our second speaker, Dr. Rafida Elias, graduated with a medical degree from University Malaya. She furthered her specialization in family medicine in UKM. And prior joining UNIMAS, Dr. Rafida has 14 years experience working with Ministry of Health. So to start the ball rolling, I would like to invite Dr. Uy to share with us on what is health screening and is it important? So Dr. Uy, the floor is yours.
Thank you, Dr. Sabrina, for the kind introduction. Very good morning and welcome to everyone who are here to join us this morning. I'm very happy that you give your time to listen to this talk. I hope that you can learn something today. Without further ado, I would like to share about what is health screening. Okay, so health screening is a process of identifying healthy people who may have an increased chance of a disease or condition. So if you look at the picture here, you can see that these are the general population, which is you and me. And the people here, what health screening does is they go for certain screening tests to see if they have any condition. And these individuals who go for screening are healthy individuals, means that they are individuals who do not have any symptoms and they are well. And what does this screening does is that you will be able to pick up individuals who have a positive test, for example, for certain conditions. And what happens is once these individuals are found to be positive for those conditions, there will be further tests done to see what is the disease or what are the illnesses they might have. And because this can be detected early through health screening, so depending on the results of the further tests, we can actually either advise the patient and support them. And if they require treatment, we can offer them treatment. And if the tests are negative, so they do not further need any other action or need any other intervention, then they can return back to as how they were. So basically, what we are doing here is we want to screen for diseases early when they are still in their asymptomatic or no symptom stage, so that we can intervene early so that we can prevent the disease from progressing further. That's what health screening is all about. Back to you, Dr. Sabrina.
Thank you, Dr. Uy. So why is this health screening important, Dr. Uy?
Okay, this is a very good question. So for individuals who are healthy, many times they do not have any symptoms. So that is why health screening is important, because we want to detect these diseases early when they have no symptoms. Okay, because when we detect early, then we can do early intervention, and many times that will be better outcome. Like for example, if you look at the picture here, I want to show you that just raise two common conditions that we face in Malaysia, which is high cholesterol and also high blood pressure. Okay, this is a survey done, a National Health Mobility Survey done in our country in 2019. So as you can see here, those who have a high cholesterol, many times they do not know they have it because there are no symptoms. So the survey found out that 1 in 4 individuals in Malaysia who has high cholesterol did not know that they have high cholesterol. And what is worrying as well is if we divide them into age groups, the individuals who do not know they have high cholesterol many times are in their early age. Okay, while those who are older, usually they will have found out because maybe they have symptoms or they go for their health screening. But those who are the young and healthy, many times they live with high cholesterol. And because they do not know they have high cholesterol, what happens over the years, high cholesterol build up this plaque and also build up a blockage in the blood vessels. And before they know it, they will have their first heart attack or stroke. Okay, so that's why if we discover this earlier, we can actually intervene to bring down their cholesterol level. Same with high blood pressure as well. Only half of Malaysians who have high blood pressure actually know they have high blood pressure. And this is very worrying because we know uncontrolled high blood pressure many times can lead to stroke and also heart attack. And because of that, many times, these individuals only find out that they actually have high blood pressure when they have their first attack of stroke or heart attack. By then, many times it's already too late. So because of that, if they were just to go for screening, and it's very simple, they just need to check their blood pressure using a blood pressure machine, they will have found out very early that they actually have high blood pressure and intervention have been done so much earlier. Okay, so because of that, that's why health screening is very important. Other than that, health screening also improves quality of life, of course, and it can also prevent early death because by intervening early by bringing down the cholesterol, for example, or bringing down the blood pressure, for example, this can prevent episodes of heart attack or strokes, and because of this, it can prevent early death. Because many times when an individual has a heart attack, it could be fatal, and they could die from that condition. Yeah, so that's why health screening is very important. Back to you, Dr. Sabrina.
Thank you, Dr. Uy. So health screening, is a process of identifying apparently healthy people who might have an increased risk of particular condition. Because usually, if we are well, we have no complaint, we won't go looking for medical consultation. Am I right? Yeah. And certain conditions, as mentioned by Dr. Uy just now, may need certain blood tests or procedure to diagnose. Yeah, that's why sometimes when you have symptoms, you were diagnosed a bit late. So at that time, probably you already have some complication of the illnesses. So moving on, Dr. Rafida, can you explain further what are the pros and the cons of doing this health screening?
Okay, Assalamualaikum and good morning to all the participants who are joining us this morning. Thank you, Dr. Sabrina, for the questions. So I will address the question by Dr. Sabrina. Let me share my slide first. Okay. Regarding the benefits or the pros of health screening, before I explain further about this is actually a bit of overlap with what Dr. Uy have explained just now regarding why we need to do health screening. But it's okay to repeat because once we repeat it, you might remember it better. So before I proceed with the explaining about the benefits of health screening, I would like to re-emphasize again what is a health screening. So health screening is done to identify disease among a person who actually do not have any symptoms, but they are at risk. So if they do not have any symptoms, most likely we do not come for health screening or medical checkup. So we might they might not know whether they have a disease or not unless they do health screening. So one of the important benefit of doing health screening to a person who are actually do not have any symptoms but at risk is to identify disease at its early stage. As everybody must know already, when we identify disease at early stage, we're able to manage it early. So most likely the outcome would be better compared to when we identify disease at later stage and try to manage and control the medical conditions at the late stage. So the first benefit of doing health screening to a person who are actually do not have symptoms but at risk is we able to identify disease at early stage. Okay. Second, better control of medical conditions. Of course, when we identify disease early, we intervene early. Most of the time when disease at its early stage, it is easier for us to control the medical conditions compared to when we diagnose it at a late stage. Is a bit difficult or takes more time for us to control the medical conditions. I'll give one example here. When we diagnose hypertension at its early stage, it could be at the pre-hypertensive stage or at stage 1 of hypertension. It's actually easier for us to control the medical conditions with maybe single medications or sometimes without medications, only lifestyle modification, compared to those who come late at maybe advanced stage like stage 3 or stage 4 or hypertension whereby their blood pressure is very high. So it might take time to bring down the blood pressure to control, or sometimes we need more medications to bring down the to control the medical condition. So the second benefit of doing health screening, after we diagnose them early, we intervene early, is much easier for us to control the medical conditions early. So that's the second benefit of health screening. The third one, with the better control of medical conditions, of course, it will prevent from long-term complications, or it can delay development of the long-term complications. Or if patients already have long-term complications, we might slow down the progression of the long-term complications with with health screening. So the third benefit of health screening, we are able to prevent long-term complications. Okay, with better control of medical conditions and ability to prevent long-term complications, of course, our patient may survive longer. They have longer life expectancy compared to those who have who present at late stage uncontrolled medical conditions, because we need to take time to bring down the medical to control the medical conditions. Or if they already develop long-term complications, it might reduce their survival or shorten their life. Okay, that's the fourth benefit of health screening, to prolong someone's life. Okay, the next one is a better quality of life. Of course, when, as I said just now, when we diagnose disease early, we're able to intervene early, so we're able to control the medications, thus prevents long-term complications. There we live with not much symptoms, or less medication to take, or no need to come to too frequent to see doctor for the review of the medical conditions. So it will lead to better quality of life compared to if patient come at late stage or their medical condition is not well controlled or difficult to control, or they already develop certain complications. They might have many symptoms related to the medical conditions or the long-term complications, and they might need more medications also to manage their medical conditions and also the complications. They might need to come to see doctor more frequent also, because of to review their medical condition and also the medications. So it will lead to poorer quality of life. Okay, the last one but not least, lesser cost of treatment. This is related to the number of medication that they need to take. Like I said just now, early diagnosis, easier to control the medical condition. They might need only a few medications compared to another group who are at late stage with uncontrolled medical conditions, require more medications. So it will incur more costs. Okay, if with more medication they need to take. Apart from that, they need to come more frequently for the visit to see doctor also. So it will incur some more cost to it, and it will increase. They will need more time also. Okay, it's time consuming. So these are the possible benefits of doing health screening, or we can call it pros of health screening also. Okay, next, I would like to introduce you to the harms of screening. You might be surprised despite all the benefits that we can get from health screening just now. So this health screening might pose certain harms also. So how health screening pose certain harms to an individual? The first one, first of all, you must remember screening. Most of the time we use certain tests or procedure to screen for disease. So person might develop side effects from the test or the procedures. For example, it can cause bleeding or infection or even pain or certain complications related to the procedures. Of course, the side effect varies, depends on the types of the health screening. Okay, and then the treatment side effect to treatments. Okay, it depends. The severity of side effect will again depends on the types of treatment that we give to control the medical conditions. So that's the first possible harms of screening, side effects from the test procedures and the treatment that follows. Secondly, possible harm can arise from the false positive result. So what is false positive result? False positive results means when your tests turn to be positive when you are actually do not have that disease. What's the problem with this false positive? When you are diagnosed with certain disease, when actually you do not have that disease, of course, it will lead to adverse psychological impacts such as depression, anxiety, or stress, or even it can affect your social well-being. Okay. Another one, third one, possibility of false negative result. This is opposite to the false positive. So false negative results mean your tests tend to be negative when actually you are have the disease. So what's the problem with this kind of test, false negative result? It will lead to the false sense of security or false reassurance from the negative result, even though you are actually have the disease, and it will lead to long-term effects of the misdiagnosis also. So these three are the possible harms of screening. So to summarize pro and cons of screening, so you have to be aware of every screening. It has its own benefits and harms. So we need to weigh between benefits and harms. We only recommend you to do screening which has been shown to have more benefit than harms, and we do not recommend you to do screening that has been shown to cause more harms than benefits. So I think that's all for my talk regarding pros and cons of the screening.
Thank you, Dr. Rafida, for enlightening us what are the pros and the cons. Again, a reminder to all our viewers. Yeah, that's why when you have the result, it can't be interpreted by just the result. Usually in medical line, we need to take further history and do physical examination as well to complement the findings that we get in the results. Yeah, because like what Dr. Rafida has shared, it can give you a false positive results. So therefore, yeah, it has to be interpreted with precautions. All right. So I'm very glad to see that we have about 289 joining us in Facebook Live and about 99 to 100 joining us via YouTube. And we have viewers all the way all over Malaysia from Sabah, UPM, Taiping, Damansara. So yeah, and all over Sarawak as well. So welcome. Thank you for joining us. And for those who join us late, just for your information, our secretariat will share the link for e-attendance in the comment section. All right, so please spend some time to fill in and make sure the info that you have filled in are correct, okay? Because e-certificate will be sent via email to you within 1 to 2 weeks time. Yeah, we don't have a QR scan for Unima staff this time. So please fill in the form as well. So moving on, Dr. Rafida, just now you mentioned about the pro and the cons, yeah, of doing this health screening. So can you share with us again, what are the recommended health screening for general population?
Okay, thank you again for the questions, Dr. Sabrina. So next, I will share with you what are the recommended health screening to be done. Just now I have told you you already know what is health screening, and I have told you what are the benefits of health screening, what are the harms from health screening, and then we need to weigh between benefits and harms. So in order for us to recommend any health screening, we have to make sure that the health screening that we recommend you to do has clear evidence of more benefits than harms. So to answer the questions just now, what is or are the health screening that I would recommend you to do is cardiovascular disease risk factor screening. So this cardiovascular disease risk factor screening includes 4 different types of risk factors here. The first one is screening for hypertension. Second, screening for diabetes. Third, screening for dyslipidemia, and screening for overweight. These 4 are not the only risk factors for cardiovascular disease, but they are the major risk factor for developing cardiovascular disease that we need to screen early and intervene early. The other risk factors for cardiovascular disease, it can be divided into modifiable and non-modifiable. These 4 are examples of modifiable risk factors that we can intervene. Okay, and there are few other risk factors that we is called unmodifiable that we cannot change. For example, advanced age. Advanced age, of course, associated with high risk of cardiovascular disease, and certain ethnicity and gender are associated with higher cardiovascular disease risk also. And sedentary lifestyle, your dietary pattern, and family history of cardiovascular disease. This history is very important. If you have family history of premature cardiovascular disease, it might put you at higher risk of cardiovascular disease, but we cannot do much on it because they are unmodifiable. But these 4 are modifiable risk factors that we can screen, and then we can intervene to prevent from development of cardiovascular disease. If you can see from here, these 3 pictures here, these 3 are example of cardiovascular disease. Okay, cardiovascular, the first one, which is cardiovascular disease, one of the cardiovascular disease is coronary heart disease. So what is coronary heart disease? Coronary heart disease is a blockage of the blood vessel. If you can see from the illustration here, blockage of the blood vessel by the atherosclerotic plaque here. Okay, for coronary heart disease, there is a blockage of the blood vessel supplying the muscle heart. And then the next one, the example of another cardiovascular disease is cerebrovascular disease. This is same, is a blockage of blood vessel by atherosclerotic plaque supplying the brain, the blood vessel supplying the brain. And then the third one is peripheral arterial disease. is a blockage of blood vessel supplying the arms and legs by same pathogenesis, atherosclerotic plaque. Okay. So next, why we need to do these cardiovascular risk factor screenings? Of course, just now we need to identify these 4 major risk factors, which are hypertension, diabetes, dyslipidemia, and obesity and overweight. There are 4 major risk factors for development of cardiovascular disease that we want to identify early, so we can offer early intervention and treatment in order to prevent this cardiovascular disease. Okay, like I said just now, coronary artery disease, cerebral vascular disease, and peripheral arterial disease are examples of cardiovascular disease that we want to prevent. So why is this cardiovascular disease so important that we need to prevent? Because cardiovascular disease has been shown to be a leading cause of death, not only in Malaysia, but globally. So we would like to prevent cardiovascular disease. The benefits from screening, risk factors, and early intervention is so that we can prevent cardiovascular disease and also cardiovascular disease related death. So I will explain to you one by one the recommendation for risk factor screening. The first one just now is the hypertension, screening for hypertension, one of the important risk factor for cardiovascular disease. So how do we diagnose hypertension? The hypertension is diagnosed based on the persistent elevation of blood pressure of 140 and above for systolic blood pressure, or 90 and above for diastolic blood pressure on 2 different occasions. Okay, who should go for hypertension screening? If you are adult age 18 years old and above, you should go for hypertension screening. How are we going to screen for hypertension? We will measure your blood pressure using blood pressure monitoring device as illustrated in this picture. When are you going to come back for screening if your initial screening is normal? So if your initial screening is normal, you still need to come back for regular screening at the recommended interval. Okay, you might need to come back every year to measure your blood pressure, or you might need to come earlier within 3 to 6 months from the first visit, depending on the level of your blood pressure. If you can see from the other side here, hypertension can be categorized into 5 categories here. You might fall, during screening, you might fall into one of the category. You might fall into normal blood pressure, or pre-hypertension, hypertension stage 1, hypertension stage 2, or hypertension stage 3, whereby patient might have already have complications from the severe hypertension. Okay. Next would be diabetes mellitus screening, second risk factor for cardiovascular disease. So how do we diagnose diabetes mellitus when screening? There are cut-off point to diagnose diabetes mellitus depending on what type of blood test are you doing. It can be fasting. If you can see here, FBG referred to fasting blood glucose. It can be from fasting blood glucose, or it can be from random. R here stands for random. Random means non-fasting blood glucose. Depending on what type of, which type of test you are doing, there are different cut-off point to define diabetes. For fasting blood glucose, the level to define diabetes is 7 millimole per liter or more. But if you are doing random blood sugar, the cut-off point is 11.1 or more. Sometimes you might ask to do other type of blood tests to diagnose diabetes, such as HbA1c and oral glucose tolerance test, if there is an indication for that. Okay, so that's how we screen for diagnose diabetes based on the blood glucose level. If you have no symptoms, just now we are stressed on the no symptom. If you don't have any symptoms suggestive of diabetes mellitus, you need at least 2 abnormal tests from any of these. You need at least 2 abnormal tests to diagnose diabetes mellitus. But if you already have symptoms suggestive of diabetes, you only need 1 abnormal test here to diagnose diabetes mellitus. So who need to go for screening? Depends. If you already have risk factors for diabetes, you might come early. You need to come early, starting from the age of 18 years old. But if you do not have any risk factors for diabetes, you may come for screening starting from the age of 30 years old. So how are we going to do screening? Like I said just now, it requires fasting or random or non-fasting blood sugar. It can be from capillary where we get your blood from fingerprint like this. This is capillary blood glucose test. But another one is venous when the nurse withdraw blood from the inner part of your elbow to get blood. This is called venous. But for screening, sometimes capillary blood test is adequate. If your capillary blood test abnormal, you might need to go for venous blood glucose testing to confirm diabetes mellitus. Okay, when you need to come back for screening, if your initial test normal, you have to do regular screening every year to check your diabetes mellitus.
Dr. Rafida,
yes.
Can you share with our viewers what is this OGTT actually? What type of test is this?
Okay, oral glucose test, glucose tolerant test. Okay, this test usually, if there is any certain indication for to do this test. To do this test, you are required to fasting for at least 8 hours. I forgot to explain just now. Fasting here doesn't mean that you have to fasting the whole day. Fasting blood glucose here means you only need to fast overnight or on at least 8 hours before you come for the blood test the next morning. Similarly, for oral glucose tolerant test, you are required to do to check your blood 2 times before you are given a special drink, which is a glucose drink prepared by staff before. It's called fasting preload. We call it pre-glucose load. If you are undergo OGTT, oral glucose tolerant test, the fasting blood glucose is called pre-glucose load. It's similar, the level cut-off point to diagnose diabetes similar to fasting blood glucose 7 millimole or above. And then for oral glucose tolerant test, you are required to drink glucose. There are certain amount of glucose that we prepared. You have to finish the drink, and you have to wait for 2 hours before we repeat the next blood glucose test. This is called 2-hour post-glucose load. Okay, and the level is similar to random blood sugar. If your your reading 11.1 and more, it define diabetes mellitus. Okay.
Yeah. So patient have to stay for at
yes.
least after they took the glucose drink before they can get for the 2 hours postprandial. So just for our viewers' information, the amount of glucose that we use in OGTT is 75 gram, which is equal to 15 teaspoons of sugar. Yeah, 15 teaspoons of sugar diluted in about 200 ml of water. Right? Okay, Dr. Rafida, can you continue?
Okay, and then not everybody will ask to do oral glucose tolerance test. Only certain group of person will be asked to do oral glucose tolerance test. Okay, next we will proceed with the next risk factor screening, which is dyslipidemia. How do we diagnose dyslipidemia? Dyslipidemia diagnosed based on the elevated lipid profile. Okay, who need to go for dyslipidemia screening? Similarly, if you are known to have other cardiovascular disease risk factors, you might need to go for screening earlier, starting for the age of 18. But if you do not have any risk factor, cardiovascular disease risk factors, you have to go for screening starting from the age of 40 years old. How are we going to do the screening? We will order complete fasting lipid profile, whereby staff will withdraw blood from your, we get venous blood. That means we need to withdraw blood from the inner part of your elbow, antecubital area. We need to send full complete fasting lipid profile. We need to review your total cholesterol level, LDL cholesterol, which is also called bad cholesterol, HDL cholesterol, which is also called good cholesterol, and the last one is triglyceride. We need to review all this in order to diagnose whether you have dyslipidemia or not. When you need to come back for screening, if your initial tests are normal, you have to come back every year to do a regular screening for dyslipidemia. And the last but not least, the fourth risk factors for cardiovascular disease is overweight and obesity screening. How we define overweight and obesity? We based on the BMI. BMI is body mass index. Okay, the level to define the value to define overweight is 23 to less than 27.5. So if you can see from the other side here, there are two types of WHO BMI classifications. This one is for Asian, specific for Asian. So for us, if you notice our cut-off point here, value to define overweight and obesity here are slightly lower compared to general population. This is because Asian population, we tend to develop complication at lower BMI level. So we have a different classification. We do not use WHO general population. We use WHO Asian BMI classification to define whether you are overweight or obese. So obesity here defined when your BMI, body mass index, 27.5 kilogram per meter square or more. And another measurement that we can do to classify obesity is waist circumference. For male, if your waist circumference 90 cm and above, you are in the obese category. Or if you are female and your waist circumference 80 cm and above, you are also in diagnosed obesity. So who need to go for screening? If you are adult, 18 years or above, you should have done this screening. How are we going to screen for overweight and obesity? Of course, just now we use BMI, body mass index. We calculate BMI based on your body weight and also height. And another measurement here to define to screen for obesity or overweight is waist circumference. How frequent we need to do screening for this? Similar is annually. If your initial screening normal, you have to come back every year to do a regular screening. Okay. So I think that's all for now. To answer the questions just now, what is the health screening that you would recommend? So I would like to recommend cardiovascular disease risk factor screening to be done, which consists of these 4 risk factor screening. It has been shown to be give you more benefits and harms, and it will help prevent, because we are identifying these risk factors at early stage, we intervene early, or we optimize the medical condition early, we might be able to prevent development of cardiovascular diseases now. And it might also prevent cardiovascular disease-related death. Okay, I think that's all for now.
Thank you, Dr. Rashmi. So as you can see, the magic number for blood pressure is 140/90, and the keyword is persistence. Yeah. So if you have 1 episodes of high BP, if you don't diagnose you as hypertensive yet, okay. So know your numbers. Okay. If there's any time you are not sure, please come and look for medical consultation. All right. So for our viewers out there, feel free to drop any questions We will try to address them along the way, all right? And updates from Secretariat, the attendance link will be shared at the end of the talk. So we have one question here in YouTube, from Kalila. Dear sir or madam, can you comment on association or relation of overweight and gout? So, Dr. Uy, would you like to share your opinion or your insight on this?
Sure. Thank you, Dr. Sabrina. Okay, I think this is a very good question, and the question is right. Indeed, if you are obese or you're overweight, it is associated with a higher chance of you getting gout. The reason is because when you are overweight or obese, you tend to have a higher level of uric acid. And we all know that a high uric acid level is associated with gout attacks, okay? So that is the reason why you will get higher chance of gout if you are overweight or obese. And also the other side is true as well. If you are able to reduce your weight, the risk of you getting gout is also reduced as well. So if you're overweight or obese and you want to prevent further gout attacks or gouty problems, one thing you can do is to definitely reduce your weight, and it will really help. Yeah.
Okay. Thank you, Dr. Uy. I hope that answers your queries. Kalila, all right? Okay. So, so far we have 350 joining us from Facebook, and another, let me see. Yep, another 123 joining us via YouTube. So welcome, and thank you for spending your time with us this morning. So moving on, all right, we shall look into what are the recommended health screening, yeah, for male. And I would like to invite Dr. Uy to share with us on this. Dr. Uy, the floor is yours.
Sure. Okay, so for men's health screening, now we are going more into the specific. But before that, I would like to just share a bit why men's health screening is important, okay? So you can see here from the screen, sorry. Many times men have a lot of health issues, okay? So men's health issues, you can see here is that 1 in 3 men has actually high blood pressure, and 3 out of 4 men are overweight, and men are 2 times more likely to binge drink than women, means they drink excessively until they drunk. And of course, 17 out of 100 men smoke versus only 13 out of 100 women. And men die an average of 5 years sooner than women. And this is true in Malaysia and also most part of the world. And almost twice as many men die of ischemic heart disease, which is heart attack. And 9 of the top 10 causes of death occur in men more than women, okay? So some of these conditions are like heart disease, cancer, stroke, etc., okay? And now, so what we can glean from here is that many times men have weaker health compared to women. And this is not just because of genetic, okay? Sometimes people think that it is because of men has maybe genetically have weaker health compared to women. So that's not really true, but it is more of because of the health-seeking behavior of men, okay? So that is why one of the things that we can actually do is to create more awareness, to let men realize, the importance of taking care of their health. And one of those is also to let them know that they are actually at higher risk of getting health problems. So by becoming more aware of this, we hope that men will be more proactive in taking care of their health. So for men, what are the type of screening they can actually go for? Actually, basically, most of them has been explained by Dr. Rafida. Only there are few maybe specific tests that are specifically catered for men, but actually most of the tests that are available are actually general for both male and female, okay? So like, for example, vision check, I think this is something that both gender can do. And of course, the cholesterol level, blood pressure, and sugar level, I think all this has been explained very clearly by my colleague, Dr. Afida. And then, of course, later, we will also share more about colon cancer screening, which is also equally important. And for men specifically, to be prostate cancer screening, okay? And of course, having said that, there are also issues regarding prostate cancer screening, which I'm also more happy to share more, okay? But generally, we don't recommend prostate cancer screening for everyone. Yeah.
I see. So Dr. Uy, what is your opinion? Because you know nowadays that you can actually go to the outside lab, right, to do some blood tests outside. So among the package they offered is cancer screening, yeah. So
Yes.
some so include like CA125, CEA, and of course PSA, which is prostate specific antigen. So if let's say a person or a client has high PSA, so does that mean that that person has prostate cancer?
Okay, I think that is a very good question, Dr. Sabrina. So, in order for us to screen for prostate, the test that we go to usually is a prostate-specific antigen. It is just a blood test where we test your blood for this PSA, okay? And depending on the level, so if there's a high PSA, usually people will think that they might have prostate cancer, but that is also not true. Reason because there are many reasons for high PSA, okay? So for example, if you have this condition known as benign hypertrophic prostate, which means that you have an enlarged prostate, your PSA could be high as well. So it doesn't mean that your PSA is high means equal to you have prostate cancer. So that is why we need to discuss this and explain to the client very clearly, okay, what are the pros and cons of doing PSA screening, okay? I think Dr. Rafida earlier had shared very thoroughly in a way for us to understand that even though health screening has their benefits, it also has their harms as well. And these are the things that we have to consider when we want to tell our patient about PSA screening, okay? Of course, by doing PSA screening, if it's high, there might be a chance the client might have prostate cancer. However, on the other side, they might not as well. So just by doing a PSA high, in order for us to confirm whether the patient might have prostate cancer or not, they will have to do further testing. For example, we may need to do a biopsy where we insert an instrument through the anus, okay, so that we can take tissue sample from the prostate and actually test it to confirm whether this could be prostate cancer or not. And doing that procedure is quite invasive, and patient may find it rather painful, and it could also affect them psychologically. So all this has to be clearly explained to the patient before they actually do PSA, so that they will understand what they might need to do if their PSA is increased or the level is high. Yeah.
Thank you for highlighting that, Dr. Uy. Yes, I do agree. Yeah, that's why we cannot just interpret based on your blood result. So most of the time, when you visit a doctor with your results, they will need to take further history and do the relevant physical examination to complement, yeah, and to support the blood investigation. All right. So so Dr. Uy, is there any other issues related to men's health that you think it's relevant to be brought up as well this morning, apart from the one that you can do from physical examination or physical findings?
Yes, of course. So I would like to share this as well, because I think this is another important issue that many times has been overlooked, and which is the men's mental health. Okay, so many times I think mental health is universal for both male and female, But particularly for men, it is an issue because men usually don't come to seek for help, especially in the mental part, okay? And statistics have shown that many times men are 3 times more likely to die from suicide compared to women. And depression is a common cause of suicide, okay? And many men actually are depressed, and whether they know it or not, but they do not come forward for treatment or to seek help. So that's why I think for the viewers out there, especially if you are a man and you know that you have this issue, I would strongly encourage you to talk to somebody, because if you do not do that, many times it can affect you many ways, okay? Of course, the worst case scenario is committing suicide, but before that, you know, you can have, because of this mental issue, you can reduce quality of life, and it affects your work, as well as affect your relationship with your family and also your loved ones. And sometimes the solution can be very simple. It's just because you are having mental health issues and you do not realize it. Okay, just by talking to somebody, whether it's somebody that you can trust, or even going to seek for medical help, it will able to help you to maybe find some solution and improve your quality of life, okay? And I have to really stress this, that just because we are men doesn't mean that we have to be strong all the time. We won't have any emotional issues, okay? It's just that men tend to bury deep down inside and just allow it to fester and cause more problems later, okay? So as same with all the other benefits of screening, the earlier that you intervene, the better the outcome is. So if you feel that you have some mental issues, please come forward early and talk about it, okay? So that you can find the solution and help, yeah? Okay.
Yeah, I do agree, Uy, because especially now with, you know, COVID-19, for the past 2 years, where a lot of sectors are being affected, and you know, people are losing their jobs, you know, they have not met their families for like 2 years until the border opens recently. So admitting that you have some mental issues is not a sign of weaknesses, okay? So if you don't feel well, talk, okay? Look for assistance, okay? If you are not comfortable talking to doctors, you can always approach your trusted friends first, all right? And do come to us, all right? Sometimes by just talking or ventilating it out, it does help. And sometimes, you know, when we think ourselves, the problem might seem very big, so you are but actually when other people look at it, it just need a very simple solution. All right, so thank you for that, Dr. Uy. So we have 2 questions in via YouTube. Okay, the second question by Kalila. So what is or are the immediate signal of high cholesterol in human body? So Dr. Rafida, can you answer this question, please?
Okay, regarding signal, you mean sign or symptom, right? Sign of symptoms of hypercholesterolemia that we might notice on human body. Most of the time, dyslipidemia is asymptomatic. No symptom, they do not have symptom if they have dyslipidemia. There is no sign to suggest that they have dyslipidemia also, unless a very rare situation where when they have familial type of hypercholesterolemia, they may have a few signs on their body, like because of the deposition of lipid on the skin, you might notice a small bump over skin, most of the time over the eyelid or certain part of the body. We call it xanthelasma or xanthoma, but that one is very rare. We seldom we seldom see that, because it's more common for familial hypercholesterolemia, but it's very rare. So bear in mind again, most of disease that we want to screen, usually no symptom, no signs. So you have to go for screening to know whether you have it or not. There's no signal or no sign to tell you that you have certain disease. Okay.
Yeah. Oh, okay. And then thank you, Dr. Rafida. So the second question in YouTube from Ibrahim B. So how does dyslipidemia affect the body? Dr. Rafida.
Okay. Dyslipidemia by itself, it doesn't affect the body, but it's one of the major risk factors for cardiovascular disease. So if you have dyslipidemia, you are at high risk for developing cardiovascular disease. The reason why we treat dyslipidemia is to prevent cardiovascular disease. If you have dyslipidemia, the medication that we would start is called statin. Statin is to prevent it's not only to control, to reduce the cholesterol level, but the main reason for us starting statin is basically to prevent from cardiovascular disease. Apart from that, statin also can stabilize if there is any atherosclerotic plaque already developed in your blood vessel, which is the pathogenesis of myocardial infarction, rupture of the atherosclerotic plaque. If patient already have atherosclerotic plaque in their blood vessel, starting statin will help to stabilize the plaque, therefore can help prevent from cardiovascular disease. As one of the cardiovascular disease just now is a coronary artery disease, apart from cerebrovascular disease and also peripheral arterial disease. So we have to remember dyslipidemia itself will not cause anything, but it is one of the major risk factors for cardiovascular disease. Our aim here is to prevent from cardiovascular disease. Okay.
Yeah, and I believe also when we have high cholesterol, yeah, so it also can affect our liver. All right. So you can have fatty liver, but this also usually you also usually doesn't have any symptoms. So it can be diagnosed either seen from ultrasound, where the radiologist will do a scan and they will see the echogenicity or the reflection of your liver through the ultrasound procedure. So this fatty liver it can present also as a deranged liver enzyme, which can be seen from your blood. Okay, and in the long run, fatty liver can actually cause hardening of your liver tissue and also further increased risk of liver cancer. Yeah, Dr. Wu, is there anything else you would like to add in on regarding this dyslipidemia?
Yeah, I just would like to add on briefly, as I think the viewers need to know that high cholesterol is an area where it has been really studied a lot by researchers, and we really have a lot of knowledge on this area. And I think the take-home message is that if you have high cholesterol, you should get yourself treated. Okay, especially if you are 40 years and above. Okay, because many times if you are treated early, especially when you found out early, the risk of you getting a heart attack or stroke can really be reduced if you can control your cholesterol level. I think there are misconceptions out there that even though your cholesterol is high and because of that you have no symptoms, it's okay, you can just leave it as it is. Because there is no symptoms, okay? You don't feel anything even though you may have very high cholesterol. But the problem is that you don't know that this cholesterol is actually slowly, it's slowly narrowing your blood vessels, And by the time where it's completely blocked, then only you feel something, and by then it's already too late. You might have a heart attack or you might have a stroke. And we have seen so many patients presented to us, in the emergency department where I used to work, where they just get a heart attack and they just die, And when we ask the family, they said, no, he has always been healthy, he doesn't have any health issues, But the problem is, just because he doesn't complain of any symptoms, he is well, okay? So like I say, those the blood vessels has been narrowing inside his body because the cholesterol has always been high, the blood pressure has always been high, but he has always been asymptomatic. And by the time he reaches his 50s, that's when most of the time it happens, all right? 50 plus, you know, they will most likely get their first heart attack or stroke. And by then, it could be too late. So I think the take-home message here is that get yourself checked for cholesterol, and if it's high, please do something about it. Yeah.
Yeah, I guess Dr. Uy also answered one question by Suhadi. Yeah? What are the common misunderstandings regarding cholesterol? So I think Dr. Uy has also answered to that. Thank you, Dr. Uy.
Welcome.
Yeah. So okay. So moving on, all right. We have heard from the in fact this morning a lot of questions about cholesterol. Yeah. Okay, that's good. All right. So moving on, let us hear about recommended screening tests for female. So Dr. Rafida, the floor is yours.
Okay, thank you very much, Dr. Sabrina. Okay, moving on. I would like to recap before I proceed with the recommended screening test for women. So you already know what is health screening. What are the benefits of health screening? What are harms from health screening? And that we only recommend certain health screening that have been shown to have more benefits than harms. And I have told you also what is the recommended screening for general population, which is the cardiovascular disease risk factor screening, consists of hypertension screening, diabetes screening, dyslipidemia, and overweight and obesity. And Dr. Uy have also shared with you what are the recommended screening for men. So now I will share with you what are the additional screening for women. So I would recommend you to do cancer screening on top of the cardiovascular disease risk factor screening. So among all cancer, only 3 that we recommend you to do cancer screening. The first one is breast cancer, followed by cervical cancer and colorectal cancer. Okay, why we recommend you to do breast cancer screening? Again, according to the statistic, okay, breast cancer is the most important cancer among women in Malaysia. And then usually breast cancer patients are diagnosed at early age, 30 years old, and usually they will present at advanced stage. Nearly half of them diagnosed at the late stage, stage 3 and stage 4. And you know that when cancer diagnosed at late stage, their prognosis and outcome is not as good as when we diagnose them at early stage. Therefore, screening for breast cancer is important. So we can, when we diagnose them early, we can intervene early, and it will improve the outcome, and will increase the survival rate. Okay. Okay, what is the recommendation for breast cancer screening? Who need to go for breast cancer screening? All women from general population aged 50 to 74 years is considered as average risk of getting breast cancer. Therefore, we would recommend you to do if you are a woman aged 50 to 74 years old. Another group that have to do breast cancer screening, of course, the high-risk women, those with a strong family history of breast cancer or ovarian cancer, they also need to come for breast cancer screening, but they need to come earlier than the general population who are considered as average risk. They need to come for high-risk women with strong family history of breast or ovarian cancer. They need to go for breast cancer screening as early as 40 years old. So how are we going to do breast cancer screening for general population and high-risk women with no genetic variants? Most of the time, we will go for mammogram. mammogram machine, if you can see from the illustration here, this the illustration shows you how roughly mammography machine or device looks like, and then how the procedure is being done. During mammography, each breast will be compressed, and X-ray will be taken from both breasts. If you have lump in your breast, it might be seen from the X-ray film. And when how frequent you need to do breast cancer screening? If your initial screening is normal, you have to, for general population who are considered as average risk as now, women age 50 to 74 years old. If your initial screening normal, you have to come back every 2 years to do regular breast cancer screening. If you are a high risk group, high risk means you have a strong family history of breast or ovarian cancer. You need to come for early screening just now, starting from the age of 40, and then you have to do regular screening more frequent than the general population. You have to do it every year. Okay, next, another cancer screening that we would recommend you to do is cervical cancer screening. So why cervical cancer screening? Okay, cervical cancer, I will show you first where is the cervix here. Okay, if you can see, this is the female reproductive system. Okay, and this is the uterus. Okay, and then the lower part of uterus here is called cervix. This is where the cervical cancer arises, from the cervix. Okay, why we need to do cervical cancer screening? Because cervical cancer screening is the fourth most common cancer worldwide. In Malaysia, is the third most common cancer among women after breast cancer, colorectal cancer, and the third one is cervical cancer. Okay, fourth most common cause of cancer death worldwide. Majority of patients, similar to breast cancer just now, majority of patients with cervical cancer diagnosed a bit late, detected at stage 2 and above. As you already know, when for cancer patient, if we diagnose them at later stage or late stage, the prognosis is not as good as when we diagnose them early. And the benefit of doing cervical cancer screening, if you do regular cervical cancer screening, according to the recommended interval, we might detect precancerous stage before it turn into cervical cancer. We might detect the precancerous lesion from the screening test. So we able to intervene early, start the treatment early, and it will lead to better survival or better outcome compared when we diagnose it late. Okay, what is the recommended cervical cancer screening? Who need to go for cervical cancer screening? If you are at all sexually active women between the ages of 30 to 65, need to go for cervical cancer screening. So if you're sexually active woman, ages 30 to 65 years old, you need to go for cervical cancer screening. How is cancer screening done? There are a few methods here. The most common one is conventional pap smear. This is one of the example of cytology-based test. Another method of screening is liquid-based cervical cytology. This is also cytology-based test, but it's a different form, liquid-based. And then another one is HPV DNA test. So which one you need to go for? It depends on the availability of the test in the health center. Most common, usually in the health clinic, we have conventional pap smear, then you can go for this. If the health center that you go to have other type of health screening, other method of cervical cancer screening, you can go for the other type of test here, which is liquid-based cervical cytology or HPV DNA test. Okay, when you need to do this. So after the initial screening, Okay, after the initial screening, you have to come back in 1 year. If you have two normal screening tests for the 2 consecutive years, subsequently you have to do it 3 yearly if you are using pap smear, conventional pap smear. If you have 2 normal screening tests, then after that you can go for 3 yearly conventional pap smear test. If you are using co-testing, cytology with HPV testing, you might increase the screening interval to 5 yearly if both results are negative. Okay, the next, last but not least, is the colorectal cancer screening. We would like to recommend you to do this colorectal cancer screening. Why you need to do this? Because this is the second most common cancer in Malaysia. For women, this is the second most common cancer among women after breast cancer. Okay, colorectal cancer always develop from precancerous polyp in the colon or rectum. The screening test, if we do a screening test, we might find precancerous polyps before they turn into cancer. So if we able to find precancerous polyp, remove it, intervene early, we might prevent from colorectal cancer, development of colorectal cancer. And screening tests will help also find early stage of colorectal cancer where treatment works best. It's always work best during early stage of any cancer. So the recommendation for colorectal cancer screening, who need to go for colorectal cancer screening? All adult age 50 to 75 years old is also considered average risk if you are age 50 to 75. So you need to go for colorectal cancer screening. If you are at high risk, because of the family history of colorectal cancer, you need to come earlier than the general population here. You need to come as early as 40 years old to do colorectal cancer screening, or 10 years younger than affected relative. For example, if your relative diagnosed to have colorectal cancer at the age of 40, you need to go for colorectal screening 10 years earlier, means you have to come at the age of 30 to do colorectal cancer screening. Okay, how are we going to screen for colorectal cancer? For general population, adult age 50 to 75 years old, we recommend you to do immunochemical fecal occult blood test, whereby you are required to collect your feces, put it in container and send to the lab for the test. For the higher risk group, if you have family history of colorectal cancer, we use a different method of screening. You will be referred for colonoscopy as a method of screening. When to repeat colorectal cancer screening if the initial one normal. For general population, you have to do it annually. If the initial one or earlier one normal, you have to come back every year to do this test, IFOBT, annually. If you are at higher risk because of the family history just now, so depends when whether the first degree relative was diagnosed at the age less than 60 years. If your first degree relative diagnosed at the age of less than 60 years old and your colorectal cancer screening normal, you have to come back for colonoscopy every 3 to 5 years. But if your first degree relative diagnosed with colorectal cancer at the age 60 years and above, and your colonoscopy is normal, you need to come back for colonoscopy every 10 years. So I think that's all for the recommended additional health screening for women, apart from cardiovascular disease respected screening just now. We also recommend you to do cancer screening. There are only 3 cancers that we recommend you to do cancer screening, which is breast cancer screening, cervical cancer screening, and colorectal screening. Okay, I think that's all from me.
Thank you, Dr. Rafida. And I believe this colorectal cancer screening also applicable to male, okay? Yeah, and even
Yes,
for female, all right?
yes, this one applicable for both male and female
Dr. Rafida,
colorectal
there
cancer.
is one question in Facebook by Cindy Nana, okay? Her question is, may I know why until age 74 years old only? What happened to those with age 75 years old? I think this is related to your slide earlier on the recommended screening age for breast cancer.
Um, for breast cancer, why it stopped at 74 years old and not for those more than 74 years old? I think most likely because all the research or study that has been done shows that the benefit outweigh risk, or the benefit outweigh harms can be seen if we do screening between the ages of the recommended ages until 74. And after that, harm might be more than benefits if you do screening after the recommended age. But again, if you want to do health screening beyond the one recommended, you have to discuss with patient what are the benefit of doing the screening and what are the harm that may arise from that screening. And if patient understand what are the possible benefit of doing it at that age and what are the possible harm from that, because once you diagnose breast cancer at that age, 75 years old, patient might need to go for certain intervention or treatment. And as I said just now, harm may arise from the treatment itself, or it may arise from the investigation test that we are doing. So it depends whether that patient uh, uh, want to um, face the risk or not. If they agree, then there shouldn't be any problem. But the most important thing, you have to discuss with patient what is going to happen after the diagnosis. They have to go for treatment and then frequent visit to clinic or hospital for treatment and for follow up. And depends, and usually need to discuss with family member whether there's any family members that can bring that patient for frequent visit and frequent treatment. And we have to explain also what are the possible side effects that may arise from the treatment. Okay, most likely why we do not recommend it beyond that age is because study have shown the harms is more than benefit if we do it after the age.
Thank you, Dr. Rafida. I hope that answers your queries, Cindy.
Yeah,
So,
maybe I can add on to what Dr. Rafida said as well. Another thing that I think we need to think about is this, okay? Whatever the recommendation that is given is actually for the general population, means that we're talking about the community as a whole, okay? But when it comes to screening, there's also another part of it which is we call individualized screening, okay? This is where the individual come forward to discuss with the doctor about the screening that they want to do. And I think this is something that it can be discussed, and if the patient understands the pros and cons of doing the screening, and if they still want to proceed, it can be done. It's no harm doing it. But whatever that we're recommending right now is what is for the community as a whole. There have been studies and research that's already been done to show that if we do this for the community, this type of screening, the benefit will outweigh the risk or the harm. So that's why we are talking about this. But at the individual level, all these tests can be done. It's just that we may need to discuss further, so that the patient understand what are the pros and cons of doing this test before we proceed. Yeah.
thank you, Dr. Uy. Yeah, I do agree with both of the speakers' feedback. Yeah, guideline is just guideline. We need to see cases individually as well. All right. So if there's any doubt, please come forward and discuss with any of the medical personnel around. All right. So we have 144 watching through YouTube and 413 watching through FB. And I understood that we even have viewers from Brunei. Thank you for joining us. All right. So Okay, there is question in Facebook by Cindy again. All right. Hi, doctor. Can you please explain about ANA test? So, Dr. Uy, can you answer this question?
Yeah, sure. Hi. So I assume that you want to know what is this test and what it does, all right? So NA test basically is what we call anti-nuclear antibody test. It is a blood test that you do, okay, to look for autoimmune diseases. Basically, autoimmune diseases means a group of disease where our own cells are attacking our own body, okay? So this is what autoimmune disease is. And there are many types of autoimmune diseases like SLE, systemic lupus erythematosus, rheumatoid arthritis, okay, scleroderma. So these are the common diseases, autoimmune diseases that we know, okay, especially I think SLE and rheumatoid arthritis are two quite common autoimmune diseases that we see. And ANA can be used to detect these diseases, okay? So that is why we do ANA testing. But having said that, ANA is not very specific, okay? I think we need to understand that even though your ANA may be high or positive, it just tells you that you might have some form of autoimmune disease. So we have to proceed with further tests to confirm what type of autoimmune disease you actually have. And this many times fall into the realm of rheumatology. So if you have done ANA test and you have some positive results, it is good to consult with your medical doctor to see whether you need to be referred or not to a rheumatologist so that they can do further testing to confirm what type of autoimmune disease you have. But you're just talking about ANA testing, basically that's what it does. It just helps us to know whether you could be having some form of autoimmune disease or not. Yeah.
Yeah, it's quite non-specific, yeah, Dr. Uy.
Yes.
So it can be the other way around as well, because for a rheumatologist to diagnose things like SLE, that sometimes ANE can be negative. But is the most important is from the history and the physical findings. All right. So there's another question here regarding cholesterol as well from LP Bakken. Okay. Maybe Dr. Rafida can answer this. So once diagnosed with fatty liver, is there any chance of recovery?
Okay, management for fatty liver. Okay, fatty liver usually associated with other metabolic problem like diabetes, hypertension, dyslipidemia. Is part of the complication of a metabolic problem. So management for fatty liver is basically to start to control the cholesterol. If patient has dyslipidemia or hypercholesterolemia, we have to control the make sure that we achieve the target for dyslipidemia control. And then another management for that is a lifestyle modification. If the patient is obese or overweight, we have to advise them on reducing the weight and reducing the weight and also diet to reduce their body weight. So whether fatty liver can be reversed or can normalize depends on the individual itself. We have to see whether you can compliance with the lifestyle modifications or not, and then how is your cholesterol levels. It's very individual. It's very hard to say whether everyone who has a fatty liver, we can treat them, normalize, make it normal. It's very difficult to say that.
Thank you, Dr. Fida. So it is possible to revert it back, provided you are able to, be actively trying to improve your condition as well. Okay. So yeah, the link for the e-attendance has been shared, yeah, in both FB and YouTube comment section. So feel free to fill in. All right. There's another question from Siti Fatimah Adris. Maybe for this, I'll get Dr. Uy to answer. All right. Hi, which range of age is suitable for health screening? Because my in-law passed away when she's 35 years old, and she only knew that she has cancer stage 4. Then 3 days after that, she passed away. So we are not sure here what type of cancer. So Dr. Uy?
Thank you very much for the question. I think this also in line with what I'm about to share. So the question is when to do health screening, all right? So I think it's related to the question. And the answer to this is actually very simple, and it is now, okay? So if you were to ask me when should I go for health screening, the answer is now, especially if you never have done any health screening before this, okay? So because I think up to now, we have already shared the many benefits and harms of health screening, but we know that many times the benefit of health screening is huge, and because we are able to detect diseases earlier and intervene. So if you start doing it now, we can detect it earlier. Because like I mentioned, we are doing health screening because we want to detect the disease before it becomes symptomatic or before you become unwell. So by doing health screening and we detect it early, we can intervene. Because before this, perhaps some of us may have the misconception that I will only do health screening when I am unwell. Okay, by then it's already too late many times, you know, and that is no longer called health screening. You are trying to find out what is wrong with my body. That is not health screening. Okay, that is you're trying to find out what is the problem. Health screening is you try to find out before there is a problem. Okay, that is health screening, and that is why the time to do it is now. When you are healthy, you don't feel anything. Do now. Okay, so there is no age limit to health screening. Even newborn have screening. Newborn do universal hearing tests. Okay, so we already test a newborn to see whether they can hear or not, even when they are just, around 6 months, 3 months, we can really do a universal newborn hearing testing already. So so you ask me, there is no specific age on when you should start doing it. You can do it at any age, okay, and you can do it now, okay. So please do health screening now and don't wait. All right. Yeah.
Thank you, Dr. Uy. So coming to the next question now is where we can go to do our health screening.
All right. So thank you for the question. I think for our country is we are quite blessed in the sense that there are many places that we can actually go for health screening. Okay. So we can go for health screening in clinics. All right. Both the government and GPs, the general practitioners, clinics, all offer health screening. So if you're not sure, you can just hop into any of these facilities, and they can recommend you what type of screening you should go for based on your age and also your gender, like what we have shared earlier. And of course, private labs all over Malaysia, whatever private labs that are available, they offer health screening as well. Okay, so those are the places that you can go to for health screening. And of course, nowadays, private hospitals, also offer a lot of different types of health screening packages. Okay, so if you were to go online and search now for health screening, you will be bombarded with so many types of health screening packages. And one of the reasons why we choose to have this talk as well is because we want to educate and give you informed decision so that you know what type of test that you should go for, because not all type of tests that are offered are necessary, or they actually may do good to you, because some of these tests you do, okay, may even harm you actually. Okay, just now earlier, I think we talked a bit about, somebody asked a bit about cancer, and we also mentioned a bit about cancer markers. So I think some of the audience might wonder, should I go for cancer marker screening? And the answer to you is actually no. You have to understand also what cancer marker does before you decide whether to do it or not. Because a lot of the cancer markers that we have today, like CA125, CEA, all these type of cancer marker tests, they are very non-specific. Even though you may get a high level, for example, positive or high level of CEA or CA125, it doesn't mean that you have cancer. In fact, there are many other reasons why your cancer marker can be high. And because of the non-specificity of these cancer markers, it actually cause more harm than good. Because once we find that it's high, the doctor will usually recommend you to do all sorts of testing to find why it's high. And many times after all the testing is done, you are normal. But the fact that you know that your cancer marker is high, it already affects you emotionally. You always have this thorn in your mind, thinking that, why is it high, And even though we have done all we could to find and cannot find anything, and some go all the way to do a full body scan, the MRI from the head all the way to the toe. And many times these are all very unnecessary testing. Okay, so that's why I think before you go for any test, especially for screening, make sure you know what you are signing up for. Understand the test, what are the pros and cons of doing the test before you do the test. Yeah, but in terms of where to do health screening, this is not an issue in Malaysia. You can do it practically almost in any of the health facilities that are available. Yeah.
Yeah, private or in government setting, Dr. Uy. Thank
Yes.
you for the very insightful info on that. I think there is one last question here from Facebook from Maricia Jernius. Okay. I think this question I'll get Dr. Rafida to answer. How about the colorectal screening recommended for those above 75 years old? Yeah, Dr. Fida.
Okay, I think this question is quite similar to the breast cancer screening just now, why we only recommend colorectal screening at certain age, but not after the recommended age. For colorectal screening, we recommend them to do up to 75 years old. So why not above that? So the answer for this is similar to breast cancer screening just now. It's because benefit has been shown to be more than harm if we are doing it during the recommended age. But subsequently, after that age, we are not sure whether doing screening will benefit the patient more than the harm it might cause to patient. At 74-year-old, it depends on patient. Certain elderly is quite fit, certain is not fit. They might have a lot of medical conditions already. And if we screen, the reason for screening is because we want to intervene, because when we diagnose, we want to intervene. We have to think about what kind of intervention for certain cancer. For example, if colorectal cancer, if we diagnose at 75 or more, we might need to subject them for surgery and also chemo, depending on the stage of the cancer. And we have to think whether patient that at that age able to bear the side effect of medication, the surgery fit to go for surgery or not. If not, then no point we are doing screening, because screening if the post screening, if we are using IFRBT stool test just now, stool or cut blood test, if the screening is positive, then we have to subject patient for colonoscopy. It's invasive. So we have to discuss the consequence after the screening. So whether that person willing to go for diagnostic test, it might not only colonoscopy, they might be subjected to surgery and chemo treatment. And as we all know, this chemo treatment also has a lot of side effects. And whether that person can bear the side effects or not. If not, then no point of us doing screening if we are not going to do any intervention. Like what Dr. Uy said just now, of course, it is individual. The most important thing, if we discuss with patient, so we have to tell them after screening, what is the next step? The diagnostic, they have to go for diagnostic test, and also the treatment, and then the harms that may arise from that procedures and also treatment. If they are not willing to go through all that, there's no point for us to screen them for cancer. And then we have to discuss about quality of life. Is very individual. Certain people might think if they need to go they have to spend most of their time at hospital for the procedures, for the treatment. It might not the quality of life is not good for them. So it's better for them. They might what we call just do nothing about it. So we have to discuss with patient the benefit and harms.
Thank you, Dr. Fida. So there's no more questions in the comment section, either in Facebook or YouTube. Just a gentle reminder to our viewer, don't forget to fill in the Google form link for the e-certificate. All right, ensure that you fill in your email address correctly, as we will send the e-certificate via email within 1 to 2 weeks time. So we have heard sharing about what is health screening, the importance of doing health screening, what are the recommended general health screening, which is blood pressure, sugar, cholesterol, and BMI, as shared by Dr. Rafida just now, and also the specific screening, health screening for male and female, all right, such as breast cancer, cervical cancer, colorectal cancer, and of course, not forgetting a very important issue, important component of health as well is the mental health, right? So we hope this session has given you insight on this topic, and next is for you to do your part to do health screening. So just a gentle reminder again, please do the screening before we have any symptoms, because once we have symptoms, that is not called screening anymore. That is what we call for looking for solution or intervention. All right. So we have come to the end of our session. I would like to thank the organizing committee, all right, and our speakers, Dr. Rafida Elias and Dr. Uy Chor Yao, for sharing their thoughts and insights on this topic today. And of course, not forgetting to our viewers who is watching streaming live via Facebook and YouTube. We hope that you enjoy the 1 and 40 minutes talk that we had this morning. Again, thank you. Have a great day ahead for our Muslim colleagues. Selamat menyambut bulan Ramadan. Thank you.